Did you know that testicular cancer is one of the most common cancers in young men aged 15 to 35? Early detection is key, but what signs should you be looking for? Stick around. Hi guys, I'm Dr. Lane from Adelaide, South Australia. In this video, I'm talking about testicular cancer, signs, symptoms, and when you should be seeking advice from a doctor. So why is testicular cancer a problem? Well, testicular cancer primarily affects young men. In fact, it's the second most common cancer we see in guys aged 20 to 40. But it can affect anyone from teenagers through to older age. As with all cancers, you want to catch them early because the sooner you find them, the more likely they won't have spread anywhere else, leading to a higher chance of cure. So, here are a few symptoms and signs you can look out for if you're worried about testicular cancer. Number one is a lump, specifically on the testicle or the tissue around it. Now, testicular lumps are really common, so if you find something that doesn't feel right, it's no need for panic, but you definitely should go and get it checked. It might be a cyst, it might even be just normal anatomy, but it's always better to be safe than sorry. Now, to find a lump, you will need to know how to check your testicles, and I'll come back to this in a few moments, so don't go anywhere. Number two, swelling. Now, it might be swelling of the testicle or even more generally, swelling of the scrotal area. But if you have any swelling, again, you should just be making an appointment to go and see your doctor pretty swiftly to find out why. Number three is pain. Now, to be fair, many people who have testicular cancer will not have any pain. And most people who have pain in the testicles will certainly not have cancer. But sometimes testicular cancer can cause discomfort, whether it just be an aching in the groin or testicles, even the scrotum, or even just a feeling of heaviness in the same region. You know, if you've ever copped a whack to the nuts, you might get that feeling you get deep in your abdomen. That's what I'm talking about. And number four, enlargement of the nipples or the breast tissue. Now again, this is not uncommon, particularly during puberty, and it often has nothing to do with cancer. But because testicles produce testosterone, any cancer that arises from the testicles can also produce testosterone. This is a reason why a cancer can present in this way. But now for some good news. Testicular cancer is one of the most curable cancers there is if detected early. And because the testicles can be easily felt, you should be able to detect a lump if you make a point of checking your testicles regularly. I always say, you're nuts if you don't check them. So how do you do this? Well, you literally just need to roll your testicles gently between thumb and fingers. And what you're doing is looking for lumps, swelling, hardness, even pain. It's a good thing to do this after a shower because the scrotum will be soft and it should be really easy to feel your testes. And remember, if you do notice anything, don't panic. Just make a time to go see your doctor to decide what you need to do next. One of the most amazing stories I've ever heard is by a young survivor of testicular cancer, a guy called Hugo Tuvey. I met Hugo a few years ago now and I interviewed him on a separate YouTube video, which you should check out if you haven't seen it. Hugo was diagnosed with testicular cancer in his mid-20s after he found a small lump in his testicle that he says felt like a frozen pea. However, he put off seeing a doctor for about 6 months before he finally got it checked. Now, luckily, Hugo's cancer was completely cured, but he spreads an important message to guys everywhere. Check your testicles regularly, and if you find anything that doesn't seem right, go and get it checked by a doctor. Now, I've got lots of other videos about sexual health, infections, you name it. So if you haven't subscribed to my channel, please do so. But until next time, guys, stay healthy. I'll see you soon.